This is Arun Goyal. Good morning, and thank you for giving me the opportunity. I am CIO of Sir Ganga Ram Hospital. So my achievements in 2021 with respect to the business growth and customer acquisitions, I would divide it into my answer into two parts. One is my role into the National Health Authority. Uh, I was project director through IQVIA and driving the project of National Digital Health Mission in NHA, which I completed in August. And later I joined Ganga Ram Hospital as CIO. So, in National Health Authority, we designed the National Digital Health Mission, which will accelerate the healthcare growth of the country in a federated way. The system is so designed that all the healthcare provider can get connected to the central server of National Health Authority, and all the patients can have health ID, or citizens of India will have a health ID. Based upon that, all the facilities will get integrated, and they can share their health records across the healthcare facility, be it hospital, private, public, diagnostics, private and public, pharmacies, and across healthcare industry, the data can be shared with respect to the patients based upon their consent. Second part is my role in the role as CIO in the Ganga Ram Hospital. When I joined the Ganga Ram Hospital, the major challenge was integration between the health HIS and ERP system. So now we have achieved that integration properly. Everything is implemented across the board in the supply chain management, in the HCM, the health, human resource management module, and the finance module. So all three have been achieved. Now we are moving into the another aspect of implementing EMR of the HIS. See, the top trends which I see is in 2022, in this will be in line with the current pandemic going on across the globe, is telemedicine, remote services, how we can provide and improve digitization in the healthcare industry, wherein we can provide every service, and as we can provide services touchless, where we can provide the services to the patient, where patients are not we need not to touch the patients, we need not to provide invoices to the patient, hard paper. The more reports, invoices, prescriptions, everything we can provide to the patient touchless. That will be those type of technologies will be booming in 2022. So as I told you that the key technologies I'm focusing on 2022, particularly in our hospital, is we are focusing on EMR implementation. So in the EMR implementation, you have to consider how you will be digitizing the prescription to be provided by the clinicians to the patient. So that is one aspect we need to consider and evaluate all available technology. Then how patient will take all these prescriptions forward, avail the services, then post consultation and discharges of the patient, how we can provide services to the patient at their doorstep, for at their home, how we can do the follow up at the patient through digital services, how we can provide IoT devices for the health monitoring at their home, so that they can monitor their health and their respective parameters at home, which is integrated with our HIS, and our clinicians through the dashboards can provide the consultation and services to the patient. Furthermore, using the ML, etc., we can integrate the clinical decision support system into our, so that while clinicians are providing their consultation to the patients, AI is helping them to provide services and making sure that healthcare services are happening error-free. So, as I told you earlier that I was part of the NDHM. I was driving the NDHM project as a project director. So next 2-3 years, I think the interoperability and adopting a global standards in Indian healthcare industry would be the basis of designing the strategies going forward in next 2 3 years, 5 years down the line, so that across the India, all the healthcare providers are able to make their data interoperable across and provide the data, patient data, to the patients as well as to the health information users or the R&D purposes, or to the government or the policy making and healthcare decisions support system, so that all over India of the overall healthcare industry get integrated and provide the integrated data to the patient. Patient need not to carry the healthcare records as if he is going to a one hospital to another hospital, he need not to carry the huge bulky files of their prescriptions, report, consultations, etc. And he can carry everything on a digital format on a mobile, wherein all the hospitals are making it available on basis of his consent, the patient's consent, respective hospitals records.
For more updates from CXO TV, please like and subscribe to our channel.